Hello, I'm Paris Boothia. Welcome to Med-Spa Lounge. Cervical cancer is one of the cancers that has been bothering both women and girls today. Actually, a research has been done. It is one of the second basically growing cancer in the whole wide world. However, in today's episode of Med-Spa Lounge, we are joined with a doctor by the name Dr.Baraza, who is a gynecologist right here in Nairobi, Kenya, and he'll be helping us to better understand what is cervical cancer, what are the prevention measures that we can take, what are the treatments that are available today in the market. So don't go nowhere. We'll be right back after a short break.
Cancer comes from the mouth of that uterus. That is now where the cervix is. In medical terms, we call it a squamous-columnar junction. That's where two types of cells meet. And at that interface, that is where the cancer originates. Now, what is cervical cancer? It's an abnormal growth of cells around that area. And before it explodes into full-blown cancer, there are telltale signs. There are changes in those cells which can take almost 10 years before cancer sets in. And that's where, when you talk about preventive, when you talk about screening, that's where to catch it before it goes beyond. Now, the cancer normally coming from that area, the cells start growing abnormally, and after some time, they now start migrating. Now, that is the cancer. They start migrating, and they can go to any part of the body. At that juncture, we can say that we would be very late. Unfortunately, it's only when the cells have grown and migrated that somebody can feel the symptoms by seeing the blood. Otherwise, there is no pain, there is no discomfort. So basically, when you talk about cervical cancer, we need to rush and diagnose its coming before the onset. Now, when you talk about the symptoms of the cancer of the cervix, unfortunately, that is already very late. And whenever you see that, it means that we already have lost in time as far as addressing the situation is concerned. But let me very quickly go through the symptoms that can come our way, although they are very, very scanty unless you go to terminal stages. The first symptom is what we call postcoital bleeding. What's postcoital bleeding? Whenever a woman has intercourse, if after the intercourse there is bleeding, okay, or just during the intercourse you see that the bedsheet is already soiled with blood, now that is something to worry. You must immediately get your gynecologist who will now examine that cervix and see exactly what is happening. Otherwise, when you talk about something like pain, that means that those cells have already detached and gone and colonized other places and done what you call a pressure symptom to the nerves around. That's when you feel the pain. Later on in the late stages, you may have discharge coming, and sometimes it can be smelling quite bad. That's called foul smelling. So that one also, when you do that, you must make sure that you get your gynecologist to look at you. Otherwise, the mainstay of this situation for any woman is to have periodic checks. That's what you call a pap smear. This is what has been there for quite some time now. A pap smear is basically checking of those cells either by taking them to a cytologist to examine them and tell us whether it's normal or abnormal, or what I call instant pap smear is when the gynecologist or any health worker who is trained to do that can just simply examine that cervix, put on a certain chemical, and after 2 minutes, we'll look at the changes and we'll have a very accurate diagnosis as to what is happening to that cervix.
Oh, folks. Wow, wow. As usual, good things have to come to an end. This has been an episode and a half. I hope you have enjoyed as much as I've enjoyed, and also you've learned so much about cervical cancer and even skin. Join us next time as we continue to learn together about skincare, skin treatment, and a lot more. Until then, bye.